Hello, my name is Dr. Jim Gardner. I'm the Medical Director at Blackpool Teaching Hospitals NHS Foundation Trust. Today is my update on Wednesday the 19th of August. And when I look at the SITREP today, the situational report, I'm delighted to say that as of now we have no COVID positive patients in the hospital. So that is an important piece of news. It's the first time I've been able to say that since March of this year. Of course, what that means is that there are no patients who are actively COVID positive. So we do have patients in hospital who have had a diagnosis of COVID, but there's nobody who is within 14 days of their first positive swab. Now, that has to come with a note of celebration and a note of caution, doesn't it? Because we know that COVID is still present in our community, and we have to remain incredibly vigilant in terms of all the things we've talked about before, in terms of social distancing, in terms of wearing face masks when in public spaces. And if you come into hospital, you'll see that is part of our whole working policy, to be wearing face masks all around the hospital. And of course, those issues around hand washing, the really important point about regular and thorough hand washing. So we will keep looking at the data and we will remain vigilant in that space. And I think we must reflect that the things everybody has been doing to keep themselves safe and keep others safe has had an impact, and we must all keep doing that. We're showing on the data 243 deaths against 239 from this time last week, and again some of that reflects people passing away in hospital who have ever had a diagnosis of COVID, and some of that again is a technical adjustment as we go back and look through the data. So moving on to other issues, the hospital is actually very busy with conditions other than COVID. Our A&E department had as many as 100 ambulance admissions on Saturday and continues to be extremely busy. The urgent treatment centre has moved back onto site from Whitegate Drive, where it moved at the early part of COVID. So there's some normality coming back in terms of our unscheduled care structures, and we've been delighted to be informed of a grant from central government of £2,785,000, which will help us do further work in modifying our systems through accident and emergency as we head towards the winter. And I'm sure we'll talk a lot more about that over coming weeks. A big development in terms of plans for patients coming to accident emergency is the use of the NHS 111 system, and there's a development in that system called 111 First, where detailed patient advice and triage advice will be given through that service. So as we go through the next few weeks, we'll be talking a lot more about everybody using NHS 111 First as their first point of contact before coming to the accident and emergency department. As ever, to say this, if people think they have a life-threatening emergency, they should dial 999. So to wrap up, thank you to everybody for the extraordinary efforts both within the hospital and outside of the hospital in getting us to this position. We have to remain incredibly vigilant. COVID has not gone away. As far as we can see, it's going to be with us for a long time, so we all need to play our part in staying safe. Thank you.